Hello, it's Dr. Eric Perman from Summit Dental Care in Twin Falls, Idaho, and one of the things we wanted to talk to you about today is dental radiographs, or what most people call x-rays. So a lot of people ask, what is a dental radiograph? Dental radiograph is an internal image of our jaw, teeth, and other surrounding structures of a person that we can't see with just a regular exam. And so by being able to see some of those things underneath the tissue that we can't see, we're able to better diagnose and take care of our patients and give them the proper care and treatment that they need. It's typically taken with something like this, which emits electromagnetic radiation, and then it is captured by either an intraoral or an extraoral sensor. And I have right here an intraoral sensor, and these are digital sensors, but these are placed inside the person's mouth at different angles with different aids to help them position them like this to capture different pictures of the patient's teeth. And with digital radiographs, we're able to reduce the amount of radiation by up to 80 or even 90% from traditional x-rays. So it's great for patient care to decrease the exposure to radiation. But it gives us a really good, crisp, clear image to be able to see, like I said, what we can't see normally with our own eyes. So intraoral radiographs are typically in three categories: bite wings, periapicals, and occlusal radiographs. And I'm going to show you here on the radiograph some of those different types, at least two of them. And the first one here is a bite wing. And one of the uses that we have with bite wings is they show us in between the teeth so that we can assess and see if there's decay in between an individual's teeth. We can also assess if there's recurrent decay getting underneath restoration margins or underneath crowns and things like that. And then we can also assess the patient's bone levels to make sure that they are staying healthy and maintaining over time. We can compare pictures over time and see those changes, and then provide the appropriate care to make sure that we stabilize that or address that issue. The other radiograph that we have that's an intraoral radiograph is periapicals. And periapicals give us the view of the tooth from the tip of the tooth all the way to the root with the surrounding bone around the tooth. We can use this for diagnosing cavities, fractures in the teeth, abscesses that may be forming at the base of the tooth or the root, and things like that. And then the other one is occlusal films, which we don't do a lot of here at Summit Dental Care. That's more done by pediatric dentists, but those can be used to assess fractures in palatal bone, cysts, or even for, like I said, pediatric patients, sometimes it's hard to get these bigger intraoral sensors in there, and so they'll take occlusal films to be able to assess small children's dental needs that way. One of the other types is extraoral radiographs, and that's your panoramic, your cephalometric, and then your CT scan. One of the things that we use here in our office is the panoramic and the CT scan. And this is an example here of a panoramic, and it kind of gives us a general overview or broad overview of the overall health, position of the teeth, sinus location, nerve location in relation to teeth, and things like that. So it's just great for a good general overall picture of everything. And then we can get into more detail with the CT scan that we do here, and we'll show you that later. The cephalometric one is typically used by orthodontists that need to see relationship of teeth and their jaws so that they know how to space things and move teeth appropriately that way. How x-rays are taken is typically the patient will be either sitting for intraoral radiographs or standing for extraoral radiographs, but a technician will drape them over with a lead apron vest and possibly a thyroid collar just to protect them from excess radiation. And then they will place this sensor in the position that we need the picture of, and then they will push the button, and then the radiograph will be taken. With the extraoral, they'll have them typically stand in a still position for a certain amount of time, while the extraoral sensor will typically rotate around the patient's head for about 10 to 15 seconds. As far as I mentioned earlier, radiation exposure with digital radiographs is a lot lower than what the traditional or older methods were. And so a lot of patients ask, well, am I at an increased risk of radiation exposure with these radiographs? And so the typical amount of radiation that a person receives per year just from background radiation is around 360 millirems. And typically at one digital x-ray is around 2 millirems. So pretty safe with what we're doing here and gives us the information that we need to be able to provide the appropriate care to take care of our patients and their oral health. So if you're concerned with radiation exposure through x-rays or radiographs, just know here at Summit Dental Care that we use digital radiograph, and so your exposure to radiation is going to be at a very low levels, very safe. So with the digital x-rays or radiographs that we take here at Summit Dental Care, we're able to see things in really good, precise images, be able to diagnose precisely and give you the proper care that you deserve and need in maintaining your oral health. So if you have concerns about overexposure to radiation or things like that and have a lot of questions, come to Summit Dental Care. We'll answer all your questions, put your concerns at ease, and make sure you get the best care in your oral health.